Adam Thomas from Osteopath Central Sports and Spinal Series Rehabilitation. Three main steps to a hamstring release. Hamstrings often lead to knee pain, or often not lead to, cause of back pain, cause of hip pain. Really important we release them. Office workers sit on them all day. They're underactive, they're short, or they're overactive and too tight. Regardless, they need releasing. The specifics of which your reason and your cause, your osteopath or Osteopath Central can help you work out. And funny thing about that is the release is often the same. It just depends on the frequency, intensity and importance of it, and the placement in your rehabilitation programs to when you should be starting or progressing these releases. It's going to come in three main phases. The foam roller is the first one. Sitting, hands, opposite foot, stability and control. Try and leave this one that we're working on, dead fish. And it's big, it's broad, it generally doesn't feel like much. If it hurts here, stay here and continue to use the foam roller up and down, find a tender spot, hang out there, relax the leg, tense the quads, relax the leg, or do whatever you feel best to get some change in that tissue. But because the hamstring is a big group and it's a big roller, we very quickly progress back onto the medicine ball, which is firmer, harder and a little bit pointier, although bigger in size. Same thing, and this is just about increasing blood flow, finding those tender points, also sometimes referred to as trigger points. If neither of those are much chop for you, you want a deeper release, again back to the lacrosse ball. Now, being on the ground, you sometimes lose the height into the yoga mat or jiu-jitsu mats, gym mats that you're working on. So having a chair or a coffee table if you're at home, where obviously I've swapped legs here, we've got the ball on top of the chair, we're at the end of the chair. Now I can weight, neutral spine, I can weight, pressure down on that hamstring on top of that lacrosse ball, and if I want to get really fancy, I can activate my quads, meaning it's lengthening out my hamstrings under pressure on pinpoint load on that tender point. Now that active fascial release is a different depth of release to a passive one. There's a little bit of a monster. You find that tender point, hang out there. Once you've released that, you move on to the next one and you work that until that tenderness settles down and you get a full release and your function of your hamstring improves. It's really important though, guys, to understand that hamstrings are often a compensation mechanism for the gluteus medius or TFL, which are muscles up around the hip, and we've also got videos for those. And so it's a sequencing effect, and your osteopath will email you the appropriate videos in the appropriate sequence. Often it will start up and around the low back or the hips before we progress down, because the hamstrings are a responsive muscle group and they respond to an inefficiency of the glutes, over tightening of the TFL or the gluteus medius, or a psoas shortening or weakness or tightness, depending on your condition. But that's the hamstring group release. Your osteopath will take you through the details of how often, how frequently, and what point to start.